Excellent. Warm welcome, everybody, and good evening. Thank you very much indeed for joining us as we host the Ask Me Anything event for dental education. A brief introduction to myself. I'm Stuart, along with Thomas. I'm one of the program directors. Like Thomas, I also work as a dentist in Cambridge, as well as working for the University at Cambridge. I also work at Aston University, course lead for the MSc in Advanced Implant Dentistry and the MSc in General Dental Practice. I'm a director of an independent academy in implant dentistry, and also I work as an expert witness for the General Dental Council and an expert advisor as well. Thomas is my colleague. We are co-directors of the dental education programme. Thomas is a senior dentist, also in Cambridge, and an educational supervisor, IACD accredited dental sedation mentor, and a course director also on the MST in clinical medicine, and that's a master's degree in Cambridge. They call them MSTs rather than MSCs for historical reasons. So just before we get to the question and answer session, I just wanted to give a brief overview of the PG Cert in dental education. It's made up of two modules. The first module being core skills in dental education, and the second one focusing on supporting learning in dentistry. Each module is split up into units. The first module is split up into 4 units: supervision essentials, chairside teaching, work-based assessment, and teaching groups. And the second one is split up into teaching in the clinical workplace, in the classroom, and finally assessing clinical learning. And this is a linear progression as we go throughout the year. Now, once you complete the certificate, the postgraduate certificate in dental education, you can then go on to the next level, which is the postgraduate diploma. And if you enjoy that so much, you can finally go on to the full master's degree, where you will matriculate with a college in Cambridge and enjoy a nice procession upon graduation through the streets of Cambridge from your college to the Senate House. These are the course fees for home and overseas learners. If you have any queries on this, please do feel free to email the admissions office at pg.admissions@pace.cam.ac.uk. When it comes to paying the fees, if you're a self-funded student, which is the majority of those who join us on the PG Certs, the instalments can be spread around 4 equal payments over the academic year. If you have employer funding, if you're lucky enough for your employer to be funding you, the payment can be made on an invoice sent to the employer. At PACE, we don't offer any financial support or bursaries. There are none currently available. A few dates just before we get to the question and answer session, just to be aware of. Applications need to be in by 28th of May, so that's the deadline for applications. And it's a Cambridge University thing where anybody who joins a course has to have an interview. We can't provide offers without interview, and the interviews will take place during June. Offers will go out normally between June and July. And if there's conditional offers, for instance, you have certain conditions you need to complete, they would need to be completed generally by the start of September. It's not just myself and Thomas enjoying today with you. We are also joined by 2 of our current learners who are on this year's programme. We're joined by Carissa and Kyriakos, and thank you very much indeed, both of you, for kindly joining us.
No problem.
So without further ado, we can get straight on to any questions that anybody may have.
Any questions that have come in on the chat already that you can share with us then?
Yeah, so I was actually going to direct this to our student reps today. What motivated you to join this particular course?
So I can go first on that one. So I'm currently a military dentist. I'm in the Royal Air Force, and I've always had an interest in teaching. Anyway, I've taught sort of GCSE A-level students and then sort of trainee nurses. And my sort of the reason I wanted to do the course is that the RAF are going to be getting foundation dentists in again. They run that scheme previously a few years ago, but they stopped it. But now that's going to be coming back. So I'm sort of setting myself up for a position as a educational supervisor. So that's me.
And Carissa, just to jump in there, I think that's a really good example of how in the criteria for joining the course, it says you must have some experience in teaching. You had that experience really in the informal teaching
Yep.
in that job post rather than, a year's formal experience as an educational supervisor. That's the level of experience that you need to be able to join the course rather than anything too strenuous on there.
Kyriakos, do you want to give an outline of your motivations for joining?
Yes, yeah, definitely. Thank you, Stuart and Thomas for the presentation so far. Just like Carissa, my teaching background was fairly informal, having dentists shadowing my work as well, mentees in the practice, so nothing formal as in university level. But after completing the clinical research, education and leadership course at the Cambridge University with the back then Institute of Continuing Education, as it was known, I was really interested in getting into education a little bit more. And I have an upcoming role as a clinical teacher at King's College, hopefully starting end of April this year. So I wanted to definitely solidify my education knowledge with this course, which has been great so far, for sure.
Amazing. We've had a couple more questions come in. One of the questions was about course suitability. I don't know, Stuart, whether you wanted to just give an overview of some clarification about that this is a progression route, so you have to start with the certificate. Do you want to just...
Yeah, so what was the question, Laura? It was about
Which-
suitability to enter the certificates, is that
It
right?
says which course is suitable for me, so I wonder if we just need to clarify about the progression route.
Yeah,
That's fine.
you're
I've
right.
got the
So
question up on my screen, Stuart, if that helps, because I think I see what Sunil is answering there. Hello, Sunil. Thank you for asking the question on there. And this is for people who may have had some training in education before and saying which course is suitable. With the University of Cambridge, everybody must start at the postgraduate certificate. Then if you want to, you progress to the diploma. If you want to, after that, you progress to the master's. You can't jump straight into the diploma without having the certificate. You can't jump straight into the master's without having the diploma. And I see you say that you have a GCAP, a graduate certificate in academic practice from King's College 20 years ago. That's going to be very useful for you in coming on the course. And you obviously have some background knowledge. But the starting point for everybody is you apply for the postgraduate certificate to begin with. That's the entry point, and then you work your way through to the other two. Stuart, any additional bits to add on to that?
only that I've just realised how to bring up the questions on my screen. That's the only thing. I was going into chat, I didn't realise it was a Q&A board. But yeah, it's
Lovely.
exactly as Thomas says. University of Cambridge doesn't accept APL, does it? It doesn't accept
Correct.
proved prior learning. In other words, it doesn't allow people to go directly into a diploma or directly into a master's with qualifications from other institutions. You do have to go through the University of Cambridge's own progression route, which, as Thomas says, is from certificate, followed by diploma, followed by master's. Although, if I'm not mistaken, Laura, I don't think you have to do them 1 year after the next. I think you can hold within 3 years. Is it 5 years, is it, Thomas?
Yeah, you
5
can take a
years,
short
yes.
break. The overall MST has to be completed within the 5-year period.
Within the 5 years, okay.
Yeah.
Because we know that people are busy working and it's a part-time course. And we've had people on lots of the other master's courses who go, I really want to do the master's, but I don't want to commit 3 years at this stage. step by step. So doing the PGC, then taking a year out, coming back, doing the diploma, taking a year out, and then coming back and doing the masters. And it spreads those things out quite nicely. Family commitments, holidays, living the rest of your life, and also work commitments. So don't feel under any pressure there.
And just going back to the student reps on that note, then, how have you found part-time study with the fact that you're both having jobs, presumably have other life commitments going on? How's that balance been?
I won't lie, it's been a lot of work. It has been a lot of work.
Yeah.
It's been sort of manageable. If you sort of cut it down into little chunks, then it's not too bad. Like quite recently, there's been a lot at once because we've had our assessment to hand in. But it's manageable if you sort of manage your time. And the virtual learning environment that we have, only a little bit's open at a time. So I think it's a little bit less daunting in that respect, in that you only have module 1 available to look at. So you don't sort of get bogged down with looking ahead too much. But yeah, it's definitely doable. But I'd be lying if I didn't say wasn't a lot of work. But it's a great course at Cambridge, so it's going to have good content. So.
And on that point, you probably know of an advertising campaign for a certain supermarket that says, this isn't just food. This is supermarket name food. And the same with any of these courses. You will find, diplomas and certificates and online learning from elsewhere. This isn't just a PGC in dental education. This is a University of Cambridge PGC. It's a University of Cambridge diploma, a University of Cambridge masters, and that does come with a fair amount of cachet within the academic world, within the educational world, within the world system of education, and therefore you earn what you get within the course. But it also means, and I know Carissa, your true background, that you have that determination to get through and get through and get through. But then the more we push you and the more we develop you, the more reward you're going to get for that at the end. You're not going to go away from the course and think, what did I spend my money for? I don't know anything more than I came and started with.
We've had a question come through about references. Can a wife or friend act as a referee, both being professionals, medical consultant and medical registrar? Stuart and Thomas, do you have a view? I can provide a university's.
I would imagine the university would say friend is fine because the friend is somebody who knows you well in a professional capacity. I would imagine a spouse might be an issue if the spouse is acting as a professional referee. What does the university say on that, Laura?
I think you're quite right that the university guidance is that they should know you in your professional capacity. They should be able to comment upon your ability to follow the course, the academic standard that you're performing at. So I would avoid close personal relationships. There is information on the PACE website about references, so that's worth having a look at as well.
Yeah. And getting back to the point of us being inclusive rather than exclusive, we don't want to put barriers in the way of people in here. The reference is to really make sure that we can see that somebody is who they say they are, the experience they have is the experience they say they have. It's not that you need to have the most glowing reference from the highest up person ever in order to get in. So don't stress too much about who is your referee. All they're doing is vouching for you that you are who you say you are, and that the experience that you say you have is correct.
We've got another question for Stuart or Thomas. Would you mind just explaining the assessments and how they look, how regular they are, the type of assessments that students can expect to have to deal with?
Do you want to go with this, Thomas, or shall I?
Yes, indeed. So with this, there's a famous quote by John F. Kennedy that says, "Ask not what your country can do for you, but what you can do for your country." And I tend to flip that round in terms of courses like this and assessments and think, well, don't worry too much about, we'll come to the details, but don't worry too much about the details and the stress of the assessments. Think more, what am I going to get from the assessments? What will I be able to do through the assessment that I can't have done before? What can I achieve through this? And that's a very good way to flip it round and not have the stress of the assessments on there. In the assignments and the assessments, there are two types we tend to have. One is small tasks that we set you during the year, step by step, sort of to practice a little bit of assessment to get some feedback. There are no marks allocated for those. It's to allow you the chance to engage to see how things are marked. And then each term, essentially, there will be an assessment that is marked. And with that, it's not being marked to catch you out. It's not a trick. It's not something that you need to run a marathon to get through. It's designed to allow you to show and to celebrate what you've learned. So that's the function of the assessments, is for you to shine with what you've learned. It's not us setting tricky questions for you to have to pass. With the assignments, they are very practical in terms of their usefulness in you as a dental educator. So it can be something like, right, we're going to get you to set an educational session step by step that you can run in practice. We're going to get you to video you doing some education, and then we're going to review this. We're going to get you to plan how you will sort out an educational problem from start to finish with a learner and a student. So it's not there to test your book learning and how much you can remember and how much you can splurt out in terms of facts. All the assessments are there to allow you the opportunity to really have a dry run of the type of things you'll be doing as a dental educator, and then have some feedback on those. Stuart, do you think that's a fair enough description of those?
Absolutely right, Thomas. The important thing is you're not sitting in an examination hall trying to regurgitate stuff that you've memorized. The assessments are all coursework based. As Thomas says, it's all about helping you to develop as an educator. It's not to trick you, not to catch you out. And interestingly, I think Carissa and Kyriakos, you had your submission deadline today, wasn't it? So I'd be interested to know how you found that. So that's your first summative assessment of the program, wasn't it?
So yeah, thank
Carissa
you.
or Kyriakos, do you want to jump in and just, as anybody who doesn't know anything about the course, just give in a sentence or two what you had to do for this assessment, and then how you found it?
Okay, so just to thank you, Thomas. So to continue with what Carissa was saying before, it is intense in the sense that there's a lot to do, right? There's a lot to take in, but there's a good breadth and depth of material that I think, and I found this in the previous course that I've done. It is surprisingly good. It is surprisingly good quality, obviously. Now, for this specific assessment, if we just focus on this example, this was us needing to design a teaching plan, get feedback on that teaching plan from tutors, from peers, and technology use in general. We had to run the teaching session, record the teaching session, get feedback on that session, and then reflect back on it. So how can we improve for the next time? So there's no one judging us. This was just purely how can we get better? And it is eye-opening when you watch yourself teaching something and you see the things that subconsciously maybe you do while you're teaching. It is an eye-opening experience. And when you reflect back on it, that's when growth happens, basically. Yeah.
Thank you, Kyriakos.
Carissa, any
You simply
thoughts?
put.
Oh, sorry.
Yeah,
Thank
so
you.
I found that this assessment was really good in consolidating the first few modules of the course. It was really, really useful, sort of applying all of the knowledge, because it's quite daunting when you start a new subject everything, like all the new sort of terminology, and it takes a while to sort of put it all together. It's like a jigsaw puzzle, and you're putting it together in your head. And I feel like this assessment's done that. So it's sort of finding out all of the pieces, and it's put it in, it's got it into my head in a sort of more structured way. So it's been really, it's been a useful assessment. It doesn't feel like it's just for the sake of it at all. It's been really, really, really useful.
Yeah, we try to make the assessments part of the learning process. So instead of just being a rubber stamp, like sitting in a hall trying to regurgitate stuff you've memorized on a piece of paper, the idea is the assessment itself is something you learn from. So thank you, Carissa.
And very much a 21st century approach to learning. We really are not all that interested in what you know, because you can look things up, you can read things, you can Google things. What we're really interested in is what you can do. And that's the difference in the assessments, maybe to courses that you might have done as an undergrad, where they say to you, now, can you remember all of the facts? Can you remember all these things? It's not a memory test. I spend a lot of my time um in practice and in a hospital setting working with foundation dentists and foundation dental therapists and in small groups and large groups. And again, there's no memory tests. It's all about what can you do? What are you safe to do? So the people in our course, we want to think, is it safe to now let you go and be an educator? Is it safe for you? Is it safe for the people you're educating? And not just safe in terms of patient safety, but psychologically safe, that you have the skills and the knowledge to be able to do this, but also that we've given you the practical, the practical run at these things, the practical experience of what you'll be doing in the real world. But also, I mean, I think you can probably see the link between Kyriakos and Carissa there, who hadn't met at all before the course. But it's developing that community of practice as well, that hopefully then will stay with you as you go, further through the course and beyond.
Great. We've got another question that's come in for our student reps. So did you have any preconceptions about coming to study at Cambridge, coming to do what is essentially a very new course, and how does that compare to the reality?
Should I jump in first, Carissa? Yeah. I was biased because I've already done a course with the University of Cambridge before, so maybe my expectations back then were different, and it was an eye-opener doing the course. So coming into this course, I knew exactly what I was getting into, but still surprisingly breadth and depth of quality knowledge that obviously I couldn't get anywhere else, in the sense as in I couldn't get the type of delivering a teaching session by Stuart and Thomas the way that they do. I don't think there's anything that we need to be worried about when joining into such a course. If you are interested in improving your dental education skills, and whether that is with a mentee in practice, or if you have an official teaching role, you're definitely benefiting from this. And even if it's team management and training your nurses or training nurses in general, that's still going to benefit all of the clinicians that can qualify for this. That's my take. I don't know if Carissa wants to add a little bit.
So I think I asked about this in my interview. Afterwards, I was like, "Oh, should I have asked that?" Because I was a little bit concerned that it was a brand new course, because we're the first cohort on this course. But I think it's not surprising, because it is a Cambridge course. It's going to be good quality. But historically, it's built on the medical education course, so there is a lot of overlap there. So I was a little bit concerned that maybe we'd be the sort of guinea pigs a little bit, and sort of courses after us would be sort of better. But it's been fantastic. It's been really, really good quality. So yeah, but that's been not a nice surprise, not too much of a surprise, but it's a good thing. I did wonder if we'd be sort of wearing gowns and eating swans and stuff, but that hasn't
That's
happened.
third year. That's third year. Yes.
Oh dear.
Yeah.
But no, it's been quite a nice sort of semi-formal but pretty informal environment actually. It's just been really quite relaxed and nice. I think Stuart and Thomas have made it very almost like peer-to-peer, just it's a really relaxed learning environment. I thought it'd be a lot more stuffy and sort of cobwebs and sort of old books, but it's been great. Madingley Hall's really a nice environment as well.
And then very interesting, Carissa, that you say it's a new course. And interestingly, Stuart and I, both as dentists, have been through the medical education masters here at Cambridge. And I think what had happened was that there were a lot of dentists coming on the medical education masters, and the medical education masters had within that dental tutors and dental educators. So for several years now, the medical education course has had this little subset of dental education within there. So it's been running quite nicely within that. And then the university just thought, actually, it's time now to break this out into its own course and give it its own name, rather than us as dentists just being a subset of the medical education course. You ask about gowns in third year for the masters. You Cambridge terminology, you matriculate into a college, and then you can officially wear a gown, one of the black gowns. You can wander around town into your shops in your black gown. You can come to the formal dinners. Something that we like to do as well is the college dinners, and we'll be arranging this, will be even before you matriculated in your certificate and your diploma, is bring you along to one of the college dinners so that you get that idea and see, and just get to see it's only a dinner. You know, people may be wearing jackets and gowns, but it's not as you say, that stuffy, cobwebby idea of Cambridge being back in the 17th century. But there are plenty of things like that if you want to explore them within the city and within the university. If you like old books, goodness, the university library is there for you. You've got full access to all these things to poke around. It's incredible fun. So whatever your level of geekness, whether it's sports or old books or footlights comedy, whatever it happens to be, there's so many bizarre things that are also open to you within the university.
We've got another question, and we already touched on this previously. Stuart, you covered it in your presentation, but if you just want to go over it again, what kind of subjects will be taught on the course?
Yeah, I mean, the PG Cert subjects are focusing on developing you as an educator. So it's down to your development. So there'll be subjects trying to lean on using educational theory to help frame how people learn, and to help us to get our mind around, sort of make sense of what works in teaching and what doesn't. What I don't want to do is try to say it's a course where you just spend a whole year learning one theory after another, because that'd be deadly dull. But we do introduce theories, but more importantly, it's about the application of the theories, how they can actually change you as an educator, how they can help you to understand what works best, and also to understand that what works for one person doesn't work for another. These are not recipes, these are just ideas that educationalists have been writing and thinking about, well, since antiquity, frankly, long time ago. And what we try to do is collect the best ideas and use them in our teaching to help you take out of those the bits that work for your individual educational practice.
Great.
Then I'm going to give the flip side of that, to say there's all that theory and the terminology and all those things. Also, the really important thing is the practical side of things. So again, as an ES, an educational supervisor, then there are very practical things. If you're engaging with students at an undergraduate dental level, there are practical things about the progression of students through the course and the practical skills and the competencies and the entrustable professional activities and all these things that you need to know at a practical level. The same if you are an educational supervisor working with foundation dentists or dental therapists in the UK. There are certain rules and regulations. There are certain portfolios. There are certain things you need to hit. There are certain ways you need to report. So we focus on the practicalities of all that as well. That's in the certificate and the diploma year. In the master's year, the final year, if you're doing the master's, that is a research project that you'll be doing. So that is you with your particular focus, and that's going to be different for Kyriakos and for Carissa and whoever else, because you will have a particular thing you want to achieve within education that nobody's achieved before. And you will do your project and your master's dissertation focusing in on that. So you will come out of that master's year with something new and unique that you have done and you have achieved that's adding to the body of medical and dental education, not just in the UK, but worldwide. And, always in the course like this, in the certificate and the diploma, always think, what big problem would you like to solve? What have you not liked about education? What hasn't worked for you? What have you seen in your students and your learners that you thought this can be improved? And that's what the master's is focused in on, rather than you learning and remembering stuff. You're very much doing and solving in there.
Thank you. We've asked for clarification about the teaching delivery. So somebody has asked if this is a fully online course. As we've established, it's not, but I don't know if you wanted to talk about the face-to-face teaching, the online materials, how the course is delivered.
Blended learning, I think, is the term. So we have a VLE which supports you with some pre-contact day videos and pre-contact day learning. The idea is that when we get to the contact days, what we try to do as much as possible is have more of a discourse, more of a discussion. As Carissa said, it's long been a tradition in Cambridge for the teaching and the learning to be seminar based, to be about people sitting around as peers, trying to brainstorm, trying to work things out themselves, rather than person at front delivering boring lectures for 5 or 6 hours of a day. But you do need to understand content, so you do need to learn stuff. But what we try to do where possible is to get that content onto the VLE before we have a contact session, and to have some follow-up content after a session where it's applicable. We do spread between, we do some on Zoom as we're doing now, and we do contact days in Cambridge. I think it's 12 days in total next year off the top of my head. Yeah, so it's focused more on discussion, really. It's focused more on us trying to work things out as a group rather than just trying to transmit knowledge from our head to yours.
Pre-COVID and pre-lockdown, all these courses, throughout the university were delivered in person, and that was, very much the way the landscape was then educationally. Then obviously during lockdown, pretty much everything was being delivered online. And now that education landscape has changed quite a lot. So we're getting the best of both on there. So the things that need to be done in person and face to face are done in person and face to face. They get the most out of this. We know that other universities will do online courses where you dip in and out. You can have Coronation Street on in the background and we're doing your ironing and just flick through and not engaging. Our online stuff isn't like that. You need to engage, because then we come back and we engage with you about what you've done on that in person. So it's getting the best of each in there. Stuart mentioned the VLE, that's the virtual learning environment. Other universities might call it Moodle. There are different, terms for this, but essentially the VLE is you will have your login, you'll have your access. You can get to the course materials, to the recording videos, to the papers, to the university resources, to the student welfare resources. All these things are the VLE. So the VLE is essentially your virtual university that you get to log into at any point.
Great, thank you. Student reps, do you have any comment in terms of the delivery of the course? Have you found the hybrid model? Oh,
sorry, I'm unmuted now. Yeah, it's been really useful actually. I think sort of we're all busy professionals, so having the online sessions has been great, but then coming down to Madingley has been really lovely as well. Because you get to meet each other in person as well, which has been really, really nice. Because I think we've really bonded as a group. Yeah, quite looking forward to seeing everyone tomorrow actually. So yeah, I think it's a good balance, definitely a good balance. And it's been really useful having sort of the pre-reading, and then you go in and you sort of feel comfortable and confident sort of chipping in and interacting in the sessions. So I've really enjoyed how it's been delivered.
Yeah.
And plus, with any form of education now, again, 21st century, 2026 stuff, that the education you will be delivering is going to be both in person and also online. So we need to be able to use both in there. Dentistry is all of our teaching delivered online. Okay, sorry.
Sorry, you
all
just
of
came out of sound slightly, but you're back.
sorry. Okay. If you can hear me again, so I was saying
Yeah.
that dentistry very much is a hands-on profession, so that it doesn't particularly make much sense to deliver all the teaching online, because we need to get in and do practical skills. We need to get in and interact together the same way as we do with our learners and our students and our dental students and our dental hygienists and therapy students and our dental nurses, because yes, we very much are hands-on rather than online as a profession.
Great, thank you. We've got a couple of questions to still go through. How many students are in the cohort? Do you want to give a brief number and sort of what the demographic is, the roles that people are in, where they are in their careers, Thomas or Stuart?
And again, that's an interesting thing about the course is if you are signing up to an online course with the University of wherever, you could have, so many people on there. You don't know how many people, you don't know who they are, you don't know what their job roles are because you never have that interaction. With us, deliberately, we keep the cohort at small group learning. So small group will be anything really between 6 and 12 in a cohort, so that you're not just a number. I remember before I went to university, our teachers at school saying, we know you at school, but when you go to university, you'll only be a number. Nobody will care about you. On a course like this, you're definitely not a number. Um, we know you, we know who you are, we get to know your preferences and your learning styles. And also that means that we can help you because you might not know or recognize where you're struggling or where your strengths are. Whereas the Cambridge way of teaching will be able to bring those out in you. You're not lost within the system. We have a mix of dentists. I think most of the people on the course this year are in general dental practice. We've got some specialists. We have some people working in hospital dentistry. We've got somebody working in the armed service dentistry. So it is a mix of what is representative of the general dental professional population, and also the course is not confined to people from the UK. We have people from overseas on the course as well, and definitely, you know, with education theory, the idea is that all these things are universal. The course and the university is a member of the Association of Dental Education in Europe, the ADEE, and their conference was last year in Dublin, which I was at representing Cambridge there, and again will be at their conference in Budapest. So meeting up with lots of international dentists in there because It's astonishing how similar, probably more so than the medical world, how similar dental education is across countries and across barriers there.
Thank you.
Age-wise, I'm trying to think of demographic things now without being too specific. Age-wise, it's like, ooh, I think there's probably an interesting range of ages. It's not all people early career or late career. There's a range in there. And, you know, everything else, you can drill down into the stats of the ED and I, but definitely, as I say, equality and inclusivity is what we're all about, rather than pushing people away and being exclusive and saying, no, you don't fit the Cambridge mold, go away. I don't think I fit the Cambridge mold. I don't think Stuart does either. And that's
There
very
isn't
much what
such a
we're trying
thing,
to
is there
encourage.
really, Thomas?
Well,
There's a
I mean
misconception, perhaps.
that stereotypical idea, the stuffy idea that people might have previously. Yes, yeah.
A misconception, absolutely.
Yes, indeed. Yes. Yeah.
Thankfully.
Sorry, Stuart, did you have something to add?
No. I was just saying,
No?
thankfully, it's a misconception. Otherwise,
Oh
I'd
yeah,
never
yeah.
got in. Yeah.
Oh, and me neither. Yes.
Okay, we've got a few minutes to go. Are we given access to numerous journals, especially dental journals? I don't know whether you want to talk about access to resources across the university.
Yeah, you have full
Wonderful.
access. Yeah.
So,
It's the iDiscover, I think it is. It's the electronic library access. You can go to the library. I think you can go to the library. Can you go to the library in any college as well, Thomas?
no.
You can't. Okay.
But you have access to their resources.
Right.
So with the physical library, pardon me, with the physical library, the University Library in Cambridge, the UL, as we tend to call it, is a copyright library. So literally every book that is published in the UK, every journal, they have a copy of it. Their online resource. So you might be used to searching on Google or Google Scholar or any of these things. You, through the course, have access to everything that the university has access to, which is pretty much everything worldwide. So when you're logged in, you can find anything and everything. You say, do you have access to dental journal? I'm going to say no, you've got access to everything. If you want to get access to journals on psychology or archaeology or Miss Marple or whatever it happens to be, you have access to all the resources that the University of Cambridge has access to, which is essentially the whole world. And with that, you can also, I mean, the first time I did this was very strange. You can get an electronic copy of papers. Most things are available electronically. Things that might be older than that, um, what they will do is they've got huge warehouses with all these things in. You request a paper, somebody will physically go and find that journal if it's not available online. They'll find that journal or they'll find that book. They will scan the paper or the chapter that you need and send it to you electronically. So there are, people who scuttle around the library all the time doing all these things. So stuff you would not have access to because it may not be published online previously, it exists in book form or in journal form, and the university can get that for you. It's extraordinary, the crazy stuff you can get.
Thank you, Thomas. Another question here. How we've already touched on this earlier, but how many assessments are there throughout the year and how frequent are they, please?
I'm going to give a very and that to say there are enough assessments, but not too many.
That allows us to
it-
change things between year to year, doesn't it?
But really, I think if you think that there is one assessment that you put in per term to get marked, and then some smaller things in between that you're showing your coloring and you're showing your working out, but they're not marked. That's there not as to assess you, but to help you get through. So really, if you think of three assessments per term, three assessments per year, that would be pretty much about it. And it's not sit and write a big long essay. It's here's a long time a long lead in time with plenty of support for you to be able to get you through this. So look in the assessments as an integral part of the journey that you're doing, rather than learning and then stopping and going to an exam hall and doing an assessment. It's not that. It's that coursework that you're doing in between. And there was a second part to that question. You said how many, and then
How
what's the
often?
how often? So again, and it's almost like it's continual assessment rather than that big thing of one final big exam at the end of the year. That is something that I hated at dental school. Um, it's almost triggering at this stage that you would go through your entire year, and then in June you would go into a big stuffy hall and be given some blank paper and be told, now write everything down that you've learned during the year, and everything you've done during the year doesn't actually count. It's not that approach. It's that continual assessment right the way through.
If I may add something on that, Laura, because I can see the worrying signs sometimes when people ask this question. It is really, as Thomas said, a continuous journey through the course. If you leave everything up until April or May and have a big assessment until April or May, you probably have forgotten everything that you've learned since September. So there are continuous assessments throughout the year. Not everything is major and not everything is marked, but that's just for us to make sure that we follow the material. If we have any questions, there are encapsulation tutorials to ask them. There are always opportunities to come back and ask for any clarifications. And that's just designed in a way that there's a natural flow, not just for the course, but for the work that we create as an assessment. And an assessment is just a word for something that we reflect, basically. It's an exercise that we reflect on something, or uh, all part of the course. Yeah.
And again, something that annoyed me at dental school was it always seemed like the exams were for them.
Yeah.
Whereas in this, the assessments are for you and for your learning and for you to get the most out of this. It's not, the assessments aren't to tick boxes for us. And then actually thinking of that, that there are other sort of bolt-ons with this. The Academy of Medical Educators, they have a graded entry into there, so you can become a member of the Academy of Medical Educators, and that is MACADMED. You get letters after your name on there. And the course is currently going through the accreditation so that when you get your diploma from us, then that qualifies you to have those letters as well automatically. And then there's the fellowship of that. So the fellowship of the Academy of Medical Educators, when you go through to the diploma and the masters, then you should have all of the evidence to be able to then upgrade to the fellowship of the Academy of Medical Educators. And these are added on, the added value things that you get from a course like this, because it is not just being able to pass the exam, but using your learning and your recognition right the way throughout to celebrate and to get those additional letters and those additional qualifications as a result of having been on the course. And it's all about celebrating your learning at this level.
I think we've probably got time for one more very quick question. We've got 2 minutes left. So back to our student reps, just to close this then. How do you envisage this course helping you in your future career plans?
Well, I think it's already been helping in terms of some of the things that I've been able to apply to my teaching already. But going forward, I'm hoping that I can become an ES. So, yeah.
I think it's going to help us in ways that we probably didn't know before. It helps with the way that you communicate with patients as well. So it's how you treat certain situations, that you're learning how to manage certain situations, and that might be either with a student, it might be with your nurse, it might be within the practice team itself, but it might also be with your patient. For me specifically, because I am getting involved, I'm dipping my toes into into dental education now. Obviously, that is something that will definitely help me develop the skill and the knowledge. But I think everyone will benefit. Everyone can benefit from this course if they put in the time as well. Yeah, they will definitely get a lot out of it.
And
Thanks
then
so
as
much.
as an ex-student of the Masters in Medical Education, but with the focus very much on dental when I was doing it, just to say that, you know, I've been through the same journey on the course that has a slightly different name. And with that, for me, in my master's year, there was a very specific problem in terms of the education and educational standards for dentists working under general anesthetic, which I thought this needs to be solved. So I thought in my dissertation, in my research project, let's look at this. That then, without me knowing it was going to, has led to that research and my findings getting into the new national guidelines for dental treatment under general anesthetic. Then on top of that, my work is now in the Getting It Right First Time reports on hospital dentistry and has been adopted by NHS Futures. And I'll be at the Association of Dental Education in Europe conference in Budapest in August, working with their community of practice and professionalism in dental education right across Europe. And together with Stuart, we're both alumni of the MedEd course, we would not be assistant professors of dental education without that master's in medical education, which we done for here. I don't think either of us thought at the certificate level in that course, this is where we would be. So I would say, what do you want to get from the course? It's impossible to know because it opens up extraordinary things that you might never have, thought to be able to achieve before that.
Great. Thank you. That was all the questions that we've received.
Thank you very much. And if anybody has any other questions, please email the team. So that's dented@pace.cam.ac.uk. And that address should be on all the correspondence and the advertising for the course as well. We look forward to seeing you all in Cambridge.
Thanks so much.
See you tomorrow, Stuart. See you tomorrow, Claire.
Everybody, see you tomorrow. See you in the morning.
Thank you.
Yeah.
Thank you. Bye.
Bye, everybody.